Greetings, friends and followers. This is Nurses Talking. I am Del Varzi. And as always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I have the very great pleasure of welcoming Katerina Jones out of California, USA. Katerina is a nurse, of course. She's a fertility educator. She is
Mhm.
an entrepreneur. She's the founder of Bloom Fertility, which focuses on fertility education and coaching and practice. And she's especially interested in focusing on people of Black and Brown communities. Like me, she loves to hike. We have that in common. She loves to hike.
Yeah.
She's an outdoor person. And so welcome, welcome, welcome,
Thank
Katerina.
you. Thank you. Thank you so much for having me on, Dale. It's a pleasure. I'm looking forward to this conversation.
It is my pleasure. I love doing this.
Yeah.
So, firstly, though, why are you a nurse? What brought you here?
Yeah, so my journey into nursing is a little unconventional, I guess. I think a lot of people enter the nursing profession because they have family members who are nurses and, their mom or their aunt or someone who they grew up kind of seeing in the nursing profession. That wasn't the case for me. I come from a family of teachers, actually. A lot of people in my family are teachers, but um for me, nursing started. I always had an interest in healthcare from the time I was young. I wanted to be a doctor actually for a very long time. My sister is a doctor. But yeah, I wanted to be a doctor. And then as I got older, that kind of just shifted into more general interest in like public health and just health policy and health education and just like health programming and things like that. So when I went into undergrad, I got my initial undergrad degree in public health, actually. And then I went back for a nursing degree. So I graduated in 2009. So I was the height of the recession in the US. And I just, with my public health undergraduate degree, like I just could not get a
I
job,
get it.
like at all.
Mm.
There was just nothing available. You either needed like a graduate degree in public health to work in, some kind of like
Yeah.
either government or organizational capacity, which I didn't have. And so I just couldn't get a job. And that kind of just I thought to myself like, all right, I need to pick something that is recession proof where I will always have a job, but that is still within the health field
Within,
because
mhm.
that's where my passion is. But I don't want to go to medical school because that's just way too much time, way too much money. So I've heard great things about nursing. I know that nurses are such a great profession, very stable profession, and also that you can do many things with a nursing degree. There are different
Mhm.
specialties you can enter. You can make nursing what you want it to be, really. And that's
Yeah.
one of the things I really love about nursing. Um, but yeah, that was kind of like it was more of a practical decision, just based in, okay, I have this interest in healthcare, and now I need something that like a profession that I can do that's going to give me like a job longevity just because of the environment in which I graduated. And so I went to nursing. I knew from the beginning though that I was interested in women's health. That was like that was the specialty that I knew that I wanted to do. So I went back to my undergrad school, same school. I went to Penn for undergrad and then for nursing as well. And went in the women's health track. And so yeah, that's kind of how I entered the profession. And here we are, the journey 10 years later.
Yes. So I'm always curious though, because nursing comes with all kinds of challenges. So what challenged you?
Yeah, so many challenges. I mean, nursing school in and of itself, I always say is like top three hardest things I've ever done. Next to birthing my children and just like becoming an entrepreneur, honestly. But getting through nursing school in and of itself was just like brutal. And I went to an accelerated program. So I did it in a year and a half, which just
Mhm.
made it even more incredibly intense. Um, so that was my introduction into just being, through the fire, right? But I think like early on in my career, one of the biggest challenges I experienced was just not having good leadership, not having good mentorship, honestly. Like It's really hard as a baby nurse when you're first entering the profession and you don't really have anybody that's kind of like coaching you through what it is to be a nurse. What are just the things that you're having trouble with, like my nurse managers, and it just I wasn't there just wasn't really good leadership. And then on top of that, very early on, I had to deal with a very high turnover. So at 6 months into my very first nursing job, I was the most senior nurse there. And I was like right out of school. And so then I just immediately became a preceptor. Then whoever they were hiring, like, started
Mhm.
training with me. And it was just that job really gave
Yeah.
me a lot of stripes, and really kind of just like threw me into what it means to be a nurse, in many ways. So that was really challenging in the beginning. And then, of course, as my career progressed, burnout became very real, more in more recent years, I think. Not really in the beginning. In the beginning, it was just kind of like, oh my gosh, did I make the right decision? Like, should I have even become a nurse?
But
Um,
that's where those burnout seeds were sown.
yeah, yeah, for sure. Because it was just, I didn't have support. I didn't have
Hmm.
structure. I was figuring out so many things on my own, and so yeah, I think you're right. It really did. That was kind of the beginning of it.
Hmm.
But I was still young. I didn't have kids. Like it was just like, okay, I'll just dealing with this. And then we moved out here to California, and that's when I started working in fertility. And so the next challenge for me was just learning fertility nursing. It is the steepest learning curve of anything I've ever had to learn. Fertility nursing is extremely complex. Like
Yeah.
there's so much science. There's just so much that we just don't learn in nursing school.
Yeah. Hmm.
So everything that I learned about fertility nursing, I really learned on the job. And I mean, you can say that for a lot of different nursing specialties,
Hmm.
but I think at least in nursing school in certain specialties you at least get a foundation because we're doing clinical rotations and things like that.
Hmm.
There's no
Hmm.
clinical rotation for like a fertility
Yeah.
clinic. you know
Hmm.
it's
Hmm.
very L&D and like OB
Yeah.
heavy,
Hmm.
which
Hmm.
makes sense because most nurses work in a hospital and that's where women's health like care is, right?
That's where it shows up.
So right,
Hmm.
that's where it shows up. So it makes sense that that would sort of be the emphasis. But how it translated for me in real life was that I was like a deer in headlights. I mean, it was just kind of like, okay, I have a degree, I have 2 degrees, and I don't know if I'm ever gonna get this. Like it's just it was really hard. It takes a good like at least 6 months to truly feel comfortable with like fertility nursing, to be like, okay, I'm starting to really understand this.
Yeah.
It takes a
Hmm.
full year to truly be able to function independently, where it's like I can answer any question that anybody like gives me. So that was a kind of unexpected challenge, I guess, was I just didn't know how hard this specialty
Yeah.
was.
Yeah.
Um, and so, yeah, it really kind of shaped a lot of how I thought about fertility nursing in the beginning and just kind of my trajectory as I went on in the specialty.
Yeah, 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 yeah. And I think that probably comes from our, when I say our, I mean collectively, or maybe even universally,
Hmm.
our perspective or our expectation that even today we still think that fertility is an unusual, or fertility or infertility, or the
Hmm.
things surrounding that is an
Hmm.
unusual thing. And it's supposed to just
Hmm.
happen. Everything is
Hmm.
supposed to just go smoothly. And
Hmm. Hmm.
um, even
Hmm.
today, when we have so many, people who have fertility challenges and things like that, but
Hmm.
still, I think, still kind of think that.
Absolutely.
Yeah.
One in 6 individuals is
Mhm.
experiencing fertility.
Yeah.
Individuals or couples are experiencing it. That is a huge segment of the population. I mean, truly.
Yes.
And I think that now is starting to become more and more understood. Like as
Yeah.
IVF is becoming more and more popular, people are really starting to be like, "Oh, this is like a problem."
This is a
This is a problem. I think when I first entered in the profession, there was still so much stigma, and there is still a lot of stigma that's attached to infertility, right? And
Yeah,
that speaks to so many different things culturally,
yeah.
just a
And
million
a
different
basic
reasons
lack of
why.
understanding too.
A basic lack of understanding, right? There's still so many people who feel like it's always a woman's issue, or, and it's just like
I was gonna go
up to
there.
50% of the cases are male factor infertility,
Hmm.
but
Yeah.
that is part of the core of why I started my business, because there is so much out there that people just simply do not know. And I was seeing it every single day in clinic, was that people would just tell me, I wish I would have known. Like, that was just the number one thing that patients would tell me was, I just wish I would have known. I wish I would have known what the process was going to be like, how much it was going to cost, what I would have to go through, the emotional side of it, like the roller coaster of the ups and downs
Hmm.
of dealing with, disappointment, frustration, heartbreak, hormonal injections. Like, there's
Hmm.
so much that goes into it, and folks have absolutely no idea until they are in the throes of it, and they're already just dealing with so much like overwhelming emotion, right? And so for me, I was seeing so much of that confusion, that just anxiety, and I was like, how can I turn this confusion into clarity? How can I help turn this anxiety into calm? How can I help people really feel confident? This sort of like, frustration, just the confidence of what it requires to go through these treatments with knowledge and information, education, so that they can make informed decisions and they're not just at the fate of, this is what's happening in my body. I don't know anything. No one is telling me anything. And they're just like in the wind flapping. I
Yeah.
just knew that there had to be a better way.
Yeah. 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 So talking about that, your company is called Full Bloom Fertility.
Hmm. Hmm.
Tell me about the name.
Yeah. Yeah, I love that you asked that, because no one has asked me, like, why did you name it Full Bloom? I love flowers, one, and I think that the symbolism of when a flower is in full bloom, it is at its greatest, it's at its height of beauty. It is at its greatest potential. And so I feel like taking that, when we are informed and empowered, especially when it comes to our reproductive health and, how we would like to plan our reproductive futures, I feel that that truly makes people bloom into their full potential. Like, who they are, the trajectory of their lives can be determined when they have knowledge about their bodies and what's going on inside of their bodies, and specifically planning their fertility. Because when you have a baby, when you start a family, can literally alter the trajectory of your entire life. And so
Yeah.
if you don't know anything about that, if you're misinformed about that, then you are not stepping into your full potential. And so for me, I just took my love of flowers and blooms, and just when a flower is opening, and it's just so beautiful to me, and like it gives off a fragrance, and it's just like, it's such a wonderful piece of nature, and it's so poignant. And I just saw the connection between, wow, like, if people were flowers, right? Like, what's the life cycle or the stage of a flower that it is just like the most beautiful, right? And it's when it's in full bloom. And so
Hmm.
that's how I came up with the
That's how
name.
you came about it.
Yeah.
That's pretty cool. That's pretty cool. So
Thank
who's
you.
your so who's your target client? I mean, first of all,
Yeah.
I know for sure without even asking that you see more women than men.
Yes, the men get brought along on the journey because they're
Mhm.
the partners, right? Um, So my target client would be anyone who is sort of reproductive age, really between the ages of 20, 25 to about 45 or so. That's usually the period of time when people are really thinking about
Yeah.
family building. So anybody who is looking to conceive, I would say within the next 1 to 3 years. Those are people who are like actively thinking about it. Anybody who is maybe looking to conceive or build their family down the line, but they're thinking about what are some options for maybe preserving my fertility. So we're talking about things like egg freezing, embryo
Mm-hmm.
freezing. Maybe you are have a partner, but you guys aren't ready, but you're like, okay, I want to create embryos and store them for the future. Anybody who is their secondary infertility. Sometimes people have children and then they're looking to get pregnant a second time and they're running into issues. So that's like a really big thing that doesn't get talked about a lot, is that
Yeah.
people assume if they had a child and before,
Yeah.
they're going to easily be able to conceive a second time. So really anybody, individuals or couples anywhere between the ages of 25 to 45, who is either actively trying to start a family, who is thinking about starting a family in the next 1 to 5 years, or anybody that's really just curious about their reproductive health and want to know more information about what their options are in the future. That's really my target audience. And then also the LGBTQIA family needs family building assistance. I mean,
Mm.
they require help to build their
Yeah.
families. So,
Mm-hmm.
they may not be they may not have textbook infertility, right? But they have what's called social infertility, which is a term that someone just recently put me onto, which I thought was great because it describes a lot of the barriers that,
Yeah.
queer people who are building families have to encounter that the non-queer population doesn't have to deal with, right?
Doesn't
Like
even think
if
about.
they want to become parents, yeah, they have to invest money, they have to invest time, they have to do all of these things, use technology to have that family that they desire. So yeah, a broad kind of swath of people.
Yeah. 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 I see you. I saw in your bio you use the term called reproductive justice.
Yes.
What do you mean?
I'm very passionate about reproductive justice. Reproductive justice is a term that I was introduced to back at my first nursing job. So, my very first entry into nursing, I worked in ambulatory abortion care.
Hmm.
And it was something that really opened my eyes to a lot of the injustices that occur for Black and Brown communities, marginalized communities, when it comes to accessing reproductive health care, understanding their reproductive health, all of these things, right? And so, reproductive justice is essentially understanding that all communities, especially communities of color, Black, Indigenous, people of color, face unique systemic barriers that prevent them from really being able to have agency and autonomy over their reproductive health, right? Because of systemic, racism,
Hmm. Hmm.
biases, access to health. I mean, the gamut runs large, right?
Hmm.
And so reproductive justice is essentially based on the tenets that we have the right to have children, not have children, to parent those children in safe environments, and that we have autonomy over our own bodies. That so linking that back to infertility,
Hmm.
I think when a lot of people think about reproductive justice movement, they think about just abortion care access and things like
Yeah.
that. But
Yeah.
it's the whole gamut. It's, part of it is to create a family. We have the right to either have children or not have children.
Not.
So
Hmm.
having children means being able to have access to healthcare,
Yeah.
equitable healthcare
Hmm.
access to create families if we need assistance with that. And so for
Yeah.
me, that's where like the intersection between infertility and access to fertility care for Black and Brown and marginalized communities is something that I'm really trying to bring to elevate the conversation with that,
Yeah.
because I think that is it gets lost. We are definitely for folks not having children if they don't want to have these children, but the flip side is also, if people want to have children, they need to be able to have good health care to help them do
Yeah.
that. And so that's
Yeah.
part of what reproductive justice is, specifically as it relates to fertility and reproductive endocrinology.
Yeah, yeah, yeah. And not for nothing, but that what you just stated, that the need to have or not to have
Hmm.
does not begin or end with fertility. It's something that it's a whole big societal issue. It's a whole
Mm-hmm.
now and future thing.
Mm-hmm.
If I cannot adequately have the family and supportive family that I should have, that
Mm-hmm.
family cannot adequately or even properly contribute to society as a whole because it's not
Right. Right.
properly, but in many instances we don't seem to see that.
Absolutely. Absolutely. And I think part of that, the other piece of it too, is that, Black families have in this country in particular, and throughout the Caribbean as well, been going back to slavery. And with
Mhm.
enslaved people, a lot of Black families were ripped apart,
Separated.
separated. Black women were used exclusively for
Yeah.
breeding more
Hmm.
children. They didn't
Hmm.
have autonomy over their own reproduction
Hmm.
because their
Hmm.
reproduction was being used for a very specific purpose.
Yeah. Hmm.
um Oftentimes we weren't even able to breastfeed our own children because we
That's
were
right.
breastfeeding the
Breastfeeding
children
someone
of,
else's. Hmm.
exactly. And so for me, it all ties into that, is that, we are taking back in multiple ways our autonomy and our agency over our own bodies when it comes to our reproduction, our capability to parent children. If we don't want them, then we have the right to not have them. It's so um Black women have experienced such, and Black families have experienced so many injustices. And so for me, the work that I'm doing is also very much rooted in making this accessible, so that people can, through education, people are empowered as opposed to being disempowered, which is what
Yeah.
historically we have
It's happened.
experienced.
Yeah.
Yeah.
Yeah. So to be a little bit lighter,
Yeah. Shifting gears.
one myth that you
Yeah.
encounter frequently regarding fertility.
Well, one of them I stated before was that it's always a woman's problem. So
Mhm.
that's one. That's a big one because,
Yeah.
again, women just get so
Yeah.
we
And
bear the
even
brunt of so many
derogatory
things.
terms, she just barren.
Yeah, literally, just like, oh, her womb is just like empty or
What's
whatever. Yeah, she's barren, like that kind of thing. But we're just seeing more and more that there are um so many men who are having issues with their
up?
sperm,
Mhm.
due to many different things,
Yeah.
environmental factors, even medications that they're
Yeah.
taking,
Yeah.
so many different things, right? And so that's probably the biggest one. Another misconception is that there's nothing that you can do to like help your fertility,
Hmm. Hmm.
which is just not true. There are so many lifestyle factors that people can do have control over that can really move the needle in terms of their ability to get pregnant. So, like, for example, your diet. I mean, nutrition is
Hmm. Hmm.
huge. Nutrition is
Hmm.
huge. A lot of people believe food is medicine, and it's like you can't be loading your body up with lots of, artificial ingredients and like all of these things and expect your hormones to function in a normal way. And I think,
Yeah.
a lot of that research is really starting to come out, the effects of, the what we eat and how
Yeah.
it is disrupting our hormones,
Yeah.
and the environmental factors as well,
Yeah.
synthetic chemicals and
Yeah.
fragrances, and those
Yes.
endocrine disrupting chemicals
Structures.
are
Hmm.
very real, and they're affecting people's fertility. So yeah, I think that people just kind of think that there isn't really anything that they can do themselves, to kind of help, obviously within limits, right? Like if you
Yes. Yeah.
have, if your tubes are blocked, you're not going to fix that with nutrition, you know what I mean? Like
Yes.
but
Exactly.
there are a lot of things that people can do. And so part of my business and what I help people consult and coach them through is a lot of those holistic, looking at it from a 360-degree view of like all of their lifestyle choices and all of the things that they are or are not doing that can potentially contribute to, helping them achieve their goal of having a baby.
Awesome. 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 Awesome.
Mhm.
Okay, I'm going to shift a little bit back to nursing. I have two more
Yeah.
questions. Well, one to nursing, one to you. And
Hmm.
one is that I want to know, so nursing, you came to nursing, kind of, although the public health was not a long career, it still came as a kind of a
Hmm.
second career. What
Hmm.
advice would you give to someone who wants to be a nurse?
Yeah. I would say, really like know your value, um and what you're bringing to the table, what you're bringing to whatever job it is that you land, like really knowing and understanding that you are a critical part of the team and
Mhm.
just like the infrastructure in general, right? Like nurses are the backbone of the healthcare system. Like we just are, whether people want to admit that or not, we are. And that's special, and I think that people think of themselves as less than if they're a nurse, or like society might be like, oh, they're just like the
Yeah.
help, or they're not the doctor. And but we are
Mm-hmm.
so valuable. We're so, so valuable. And I think just really knowing that, and understanding like your worth and what you are bringing to the table in your job is very important. And I would also say, honestly, setting boundaries early, like in your job, is critical because the understanding oftentimes is that nurses are just we get everything
Yeah.
put piled on. We get admin, we get patient care,
Whether
we
I was
get
about to say whether it's nursing or not.
exactly, whether it's nursing or not. It's like, oh, well, the nurses will do it. And it's
Mm-hmm.
just so, um, yeah, that is just the fastest route to burnout, And unfortunately, we exist within an inherently dysfunctional system. The American healthcare system is just truly dysfunctional. So we are all doing the best that we can in that system, right? But I think really having the confidence, and part of knowing your worth is understanding what your boundaries are and expecting that people are going to hold to those, and like making that kind of non-negotiable in the beginning. Obviously you
Yeah.
have to be a team player and you know um really be willing to help out and be part of the team, and stuff like that does require sometimes you know doing things that might
Flexibility.
not
Mm-hmm.
flexibility, right? Like might
Mm-hmm.
be not necessarily in your job description or whatever, but I think where nurses get caught up is just if there's a repeated pattern of consistently doing that and then consistently being the one to just like, because they will, people are going to put
Set that
you,
way.
yeah, the system is set up that way. Exactly.
Mhm.
And so, yeah, I would say that that's probably the biggest thing that I would tell someone who was, if they were thinking about becoming a nurse.
Lastly, I know I said you like hiking. I'm focusing on that
Yes.
because you know what? That one resonates with me. I love it too. But what do you do to
Yeah.
care for you?
Yeah. The definition of self-care has really changed for me over the years, especially as I became a mom. I think self-care for me has become really turning inward and asking myself, okay, what is it that I really need in this moment and giving it to myself? Like, sure, I love to like get a pedicure and like get a massage. I just got a massage yesterday. That's like a non-negotiable for me. I get one at least once a month. I get a full body massage. But for me, yeah, it's really tapping into what it is that I'm needing in the moment. If I notice myself having a short temper with one of my kids, or, really just feeling just like, I'm like, I had like taking a beat and literally asking myself, like, what is it that you need in this moment? Are you tired? Are you hungry? Do you need to go outside? Do you just need to go for a walk? Do you need to stretch? Just have a little stretch session. Do you need to drink some water, take a break?
Hmm.
Whatever it is, like, and doing it and literally giving it to myself, because my tendency is to keep going, to like push to put be like, oh, I'll just like, it's fine, I can push through it,
Yeah.
whatever.
Yeah.
But I think especially after my second kid, who is still a baby, I just had her in January, this past year, so she's
Mm.
almost one, um has really and trying to build a business from the ground up and everything like that, I it's like if I need to take a 20-minute nap, I'm gonna go lie down and
You're
take a
gonna,
20-minute. That's what
yes,
I'm gonna do. You know, like that
yes.
for me is really self-care and getting outside. Like that is just such a we went on a family hike on Sunday and it was just so rejuvenating. Like it was just I'm just
Mhm.
outside and I'm like, ah, this is so nice. It immediately it just like it's like an instant mood reset, you
Yeah,
know?
yeah. hmm
Yeah.
It's an
Yeah.
instant reset. That's exactly right. That's exactly right.
Mm-hmm.
Katerina,
Mm-hmm.
I cannot thank you enough for this conversation. I have
Oh,
truly,
thank
truly,
you.
truly enjoyed it.
Same.
Thank you so very much. Are there any last words you want to leave
Same.
us with?
Just, you know, we're all keep just stay in the good fight, nurses. That's all I can really say. We're all going through it, you know, we are all just but we are such treasured contributors to society, to healthcare, but society in general. And, you know, if no one has given you your flowers today or recently, I will definitely be the one to say that you're doing a great job. We're all just really doing the best that we can. And yeah, you just keep going.
Thank you, Katerina. That's fantastic. That's really beautiful. Thank you so much. And this
Yes.
is Nurses Talking. Like, subscribe, comment. Thank you.
Thank you.